So going off of motivation, we have different types of motives that we experience. So all people have a kind of opposing personality traits within themselves. And usually when we talk about motivation, it's these two that we're going to be talking about. There's the motive to achieve success. So this is the capacity to experience pride in accomplishments and the desire to challenge oneself. So this is the type of person who kind of takes on difficult things in life, looks to set high goals to, to hopefully, and then really feels good about achieving them. And then there's the motive to avoid failure. This is the desire to protect your ego, and this is more about avoiding the perception of shame than about avoiding failure. But you're basically trying to avoid shame because you're worried that if you don't accomplish something or you don't, you fail at something, that there's going to be this perception of shame that people are going to have of you that you couldn't achieve something. So there's this kind of constant battle, and again, you'll have people who kind of allow the motive to achieve success kind of supersede the motive to avoid failure. So this aspect here, the individual who has a little bit more of a motive to achieve success, they're the types of individuals who tend to accept challenges more, whereas people who kind of have a little bit more of the motive to avoid failure, they'll kind of lower the bar for themselves a little bit because then, they have a reason to, they have a reason to, have excuses and kind of avoid, they're just looking to avoid that failure aspect. So continuing with motivation, so one of the things that we want to, particularly with if we're looking at sports psychology, the motivational act of skill learning, self-controlled practice. So what self-controlled practice is, it kind of involves the athlete or the individual in decisions related to practice structure. So that looks at including when to receive feedback and which skills are practiced, as well as how, kind of asking them how they feel, how they're doing. This tends to promote a more active involvement in practice sessions and can enhance feelings of competence and autonomy. So it kind of gives the individual a little bit more, a little bit more of a sense of control of what they're doing, kind of helps their confidence a little bit with self-controlled practice. There's also the aspects of positive reinforcement. So positive reinforcement is the act of increasing the chance of a given behavior by following it with, by presenting with an action or an object such as praise or prizes, rewards. So that's positive reinforcement, whereas negative reinforcement increases the probability of a given operant by removing something or an event that is aversive. So again, positive and negative reinforcement, again, are both things that could be, motivational aspects for individuals as far as, getting better at something and making sure that, certain behaviors and skills are encouraged. There's also the concept of punishment. I mean, again, just like you have positive and negative reinforcement, you have positive and negative punishment. So positive punishment is the presentation of an act, object, or event following a behavior that could decrease the behavior's occurrence. Whereas negative punishment is, again, the removal of something valued. Okay, in the case of an athlete, that could be, for instance, just playing time by a coach. Again, when we look at the, both positive, negative reinforcement, positive, negative punishment, you have to kind of look at what the role of it should be. So coaches should generally subscribe to reinforcement strategy to assist athletes in focusing on what they do correctly. And punishment should be used sparingly because a lot of times it increases the likelihood that the athlete will focus on what he or she is doing incorrectly. So in other words, you want to kind of focus, if they're constantly focused on what they're doing wrong, there's going to kind of be that kind of cognitive block to what it is they're doing. Positive reinforcement aids the focus on kind of task relevant cues. So it kind of redirects their attention a little bit better. So it's important to do that. So you have to be careful with negative, any type of negative punishment or negative reinforcement, because a lot of times you can get like a lack of effort from that. if attempting to be correct. So again, it's always a balance. Just know the differences between all of these different types of both reinforcement and punishment. Punishment in general tends to just flood attentional capacity with just task irrelevant cues. So that's the other thing too. If someone's trying to learn a new skill and they're constantly worried about getting punished, that again they don't start to think about what it is exactly that they should be doing. They kind of just focus on a lot of the negatives, and that could create a lot of issues when you're talking about skill development. So looking at attention and focus. So, first thing to really note is just, the ability to focus attention on task relevant cues. So we're just talking to like learning a skill, being able to do, just whatever it might be, whether it's a sports skill or something else, just when you're first learning something. The ability to focus attention on relevant cues and the ability to control distraction is an important skill that can be learned, and it can be improved with increased experience. So when we look at attention, so the definition of attention is just the processing of both environmental and internal cues that come to awareness. So it's kind of your ability to sort of maintain both an awareness of the environment and just internally what's going on with you. Selective attention is the ability to inhibit the awareness of some stimuli in order to process others. So in other words, it's when a person could kind of get focused on certain aspects and not allow distractions to get in the way. And this is really important when you're learning new skills, to be able to process some things but sort of inhibit or not pay attention to others, because obviously too much cognitive awareness of things can inhibit your ability to learn things. One of the ways that a lot of people tend to kind of deal with this is through the process of routine. So this is kind of adoption of a ritual or a mental checklist. Your textbook gives the example of place kickers in football, kind of dealing with anxiety and attentional challenges by just kind of going through a mental checklist of things when they go to do stuff. So they might do like a little mobility drill, or just kind of like check the turf or the ground to make sure, or they have this list that they go through their head. And what that does is it kind of allows them to, to focus more on what they're doing as opposed to all the other distraction things. If they're going to kick a late game field goal to either tie or win the game, if they go through this ritual, then it's just like any other day or doing anything else. So again, the whole idea here behind things like routine and selective attention in general, I didn't mention this before, but it's also known as level of focus, again, is to suppress task irrelevant stimuli and thoughts. So again, part of what, again, just going back to the example I gave, part of the reason for going through that routine is to suppress the task irrelevant thought of maybe the situation of the game for the kicker. So, in a close game where, again, their kick either ties or wins the game, it's a lot of pressure. But if by going through that ritual or mental checklist, it kind of helps with that selective attention of just kind of going through the process of what it is they have to do. So an interesting thing came out of sports psychology when they talk about shifting categories of attentional styles during athletic performance. And again, this isn't just something that necessarily will just apply to sports. This could apply to a lot of things in life in general. But what we found is with attention and focus, there's these two broad categories, and they kind of interact with each other. So this quadrant was designed. So there's two dimensions here we look at. We look at internal versus external. So we look at someone who is a situation where someone's more introspective and looks inside, whereas someone who's a little bit more externally orientated. Okay, then you have both broad and narrow. This is your second dimension. Okay, this is someone who is a little bit more integrated versus someone who is a little bit more highly selective in what they kind of view. Okay, so these two dimensions kind of come together in kind of an overlapping continuum. And what that ends up looking at is you end up having these 4 different styles that come out of this as a result of the interaction. So in other words, someone who has more of the broad and external, they tend to assess. External and narrow is act. Broad and internal is analyze. Internal and narrow is prepare. So the individual styles that kind of come out of this, okay, when you have the broad external, that's when athletes tend to assess the situation by kind of looking at the environment and the different elements within it. The broad internal is when athletes process information and develop a strategy. The narrow internal is when athletes mentally rehearse an upcoming action. And the narrow external is when an individual specifically focuses on 1 or 2 external cues to generate an action. Okay, so that's how these things come together. So kind of understanding an individual's attentional style can kind of improve what it is that when you're communicating with them, how you could actually be more effective. Okay, so again, an example given is a player who tends to become overloaded with external stimuli might be coached to focus on maybe 1 important cue. Okay, so if someone's a little too overloaded, they're too externally focused, and that bothers them, have them focus on 1 thing. Athletes sometimes who, again, another example given in the book is athletes who seem to get kind of lost in their own head could practice describing something out loud, what they're doing. So again, it's kind of knowing what where someone's attentional style is, and then working with that in order to kind of allow them to improve or get better at whatever it is that they're doing. Okay, so some psychological techniques for improved performance. So these are all different techniques that could kind of be utilized and kind of help with elevated levels of arousal and anxiety. And some of them are simple and some of them are a little more complex. Diaphragmatic breathing is probably one of the most basic types. This is just when individuals will kind of utilize focusing on their breathing and help clear their mind, increase concentration. Key with this is make sure you're not using, accessory muscles of breathing, because that'll create more tension. The person just has to focus on using their diaphragm, getting their rib cage to expand appropriately while they're breathing. That could assist with that. Progressive muscular relaxation is just going through a series of alternating tensing and relaxing phases of muscles throughout the body from head to toe. This allows individuals to become aware of somatic tension and be able to control it. So somatic tension even, can disrupt athletic, competition. It could cause injury. So this is something that will kind of physically assist the person with producing that somatic relaxation, in addition to just, again, cognitively kind of having a clear head. Autogenic training kind of has a similar focus as progressive muscular relaxation. The difference being is, instead of you focusing on tensioning muscles, what you do is you kind of focus it's described as a sense of warmth and heaviness. So it's more of a attentional thing as opposed to a physical thing where you're tensing up the muscles, and the reason why you might pick one over the other. If you have a person who's maybe injured, or maybe an older individual who can't, there's a little bit more trouble with the progressive muscular relaxation. In other words, the actual physical tensing of muscles produces a problem. You could use this. It's more of an attentional focus on different muscle groups as opposed to the physical tensioning of them. And systematic desensitization, this is of all of them, is probably the most complex of these. And this is when you combine mental and physical techniques and allows an individual to replace a fear response with a relaxation response. So essentially what you look to do is you look to take a stressful situation that normally would create anxiety, tension, what have you, and you use what's a technique called counter conditioning, where you basically learn to do relaxation and use coping skills to deal with gradually progressive, more and more stressful situations to kind of control arousal and anxiety. So, and you'll actually use some of the other techniques described here to do that. One example I always give is if you take someone who has a fear of dogs, okay? So take someone who has fear of dogs, you put them in a room, you start with bringing into the room maybe like a small breed dog. So usually people who are scared of dogs, they don't really, they're scared of most dogs. So you bring a small dog into the room, okay? Maybe have them 20 feet away from the person, you know, get the person to control their anxiety. Probably pretty easy. If it's a small dog, they're far away from them, it's not that hard to control. Then you bring the dog over to the person, have the dog sit next to the person. That individual will then go through, again, utilize techniques to control their, you know, anxiety, their somatic, their cognitive anxiety, whatever technique that may be. Then maybe your next step would be bring in a large breed dog that, you know, classically, you know, again, most people might be scared of, let alone a person who has just an overall fear of dogs. And you have them go through, again, the same process. Maybe the dog's far away from them. Now, again, that anxiety is probably going to come back because it's a larger dog. Get them to go through techniques, coping skills to deal with that stress. And then so on and so forth. Next, bring the dog over to the person. They go through it. Each time they're faced with a level of stress dealing with their situation, they're taught to relax, okay? Now, this requires them to be, you know, kind of skilled at some of these other techniques. So they probably have to be skilled at either, you know, diaphragmatic breathing, even mental imagery may have to help with the situation, which is something we're gonna talk about in a little bit. Progressive muscular relaxation. So they kind of have to be pretty skilled at techniques related to stress management in order to do this. But it's a very effective way, particularly for individuals who kind of have difficulty with coping skills and difficulty with relaxation, to be able to go through these kind of controlled levels of exposure to different things. So kind of a question becomes is how should athletes, and again, you can apply this to anybody, but how should athletes use arousal control techniques when they're learning new skills? So the way to kind of utilize this so that individuals could use things to their advantage is an athlete should employ arousal reduction techniques when performing a new skill or one that's complex. So if they're learning a very complex skill or something that's new, they should try to do arousal reduction, because again, arousal that's too high when learning something that's new, it tends to be a little too much and kind of overloads the individual, and then there tends to be a lot of cognitive distraction with that. Whereas if someone's learning simple skills or ones that are easy to learn, use arousal enhancement, because that's when you want the person's arousal to be a little bit higher, because simple skills, if you don't kind of pay attention more to them or kind of hold them in a higher regard, that's where you'll tend to slip up with the simple skills. Remember, if you go to kind of that optimal arousal thing that we talked about earlier, again, it's a matter of whether you're doing something new and complex or maybe simple or easy to learn, as to maybe where the level of arousal should be. Okay, so that's kind of an important thing. So the purpose of employing techniques is to just allow individuals to perform with kind of an unburdened mind and be able to kind of match their mental and physical intensity to the demands of the task. So to even make it sound more simple, if the demands of the task are high, then you want that arousal to be maybe slightly lower. You want to use arousal reduction techniques, as opposed to if the physical demand or the intensity is low, you want arousal to be a little bit higher, and you may want to enhance the arousal in order for them to perform the skill effectively. So again, more techniques for improved performance. So imagery, I kind of led into imagery a little bit when we were talking about systematic desensitization. So this is the cognitive psychological skill where athletes use senses to create a mental experience of either athletic performance or a situation. It kind of allows individuals to get used to uncertain environments over longer periods of time, despite maybe minimal real world competitive opportunity. So individuals kind of create this mental experience where they think of themselves doing something maybe in a certain situation. So that would be your mental imagery. So that's something that can be very important for improved performance. Self-confidence is just the belief that one can successfully perform the desired behavior, so it's very simple. Self-efficacy is a situationally specific form of self-confidence. So self-confidence is just the general belief that one can perform a desired behavior. Self-efficacy is a situationally specific. So it's the perception of one's ability to kind of perform a task in a given situation. And there's a number of different sources where this comes from. So self-efficacy comes from performance accomplishments, vicarious experiences, verbal persuasion, imaginal experience, physiologic states, emotional states. And this influences people's choice of activity and also influences their level of effort in that activity and how persistent they'll be when facing challenges. So self-efficacy is really important from just a confidence standpoint when you're doing things. And individuals' kind of experience from those sources will kind of dictate how well or the confidence level individuals have when performing things. Self-talk is another type of technique, psychological technique. It's designed to enhance self-efficacy and kind of aid in directing proper focus, help in regulating arousal levels, and reinforce motivation. So self-talk is just the things that we kind of say to ourselves, either out loud or in our heads. They could be positive, they could be negative, they could be instructional, but it's just ways to kind of help redirect focus or reinforce motivation when we're performing tasks. Goal setting is also important when you're looking at just the psychological aspect of improving performance. You always talk about some of the best athletes or just some of the most successful people that in the world, they're goal setters, and some of them go as far as writing goals down. Emmitt Smith, the NFL's all-time leading rusher, he was noted for his entire life to physically writing down goals. And when he came into the NFL, he had his list of goals. He still actually has it from when he wrote them down. So there's different types of goals. There's process goals. Okay, those are goals whose achievement the athlete has control over. So those are kind of part of the when an individual is going through things, these are things that an individual can kind of accomplish. There's outcome goals. Now, outcome goals, individuals have little control over. So if someone says, well, I have a goal of, winning, or of winning this championship. Well, you have some control over that, but you don't have complete control over it. So, process goals are good because they're goals that an individual can kind of, see kind of achievement with, and they have control over. And they could kind of prioritize that. Short-term goals are goals from a time frame perspective. These goals increase the likelihood of success because they are relatively close to the present ability. So usually when you're setting short-term goals, you have to set realistic short-term goals because those are usually those that are kind of completed, again, in the short term. So you don't want to set them too high, because if you set them too high, they're going to be a lot more difficult to achieve. So in rehabilitation, we set short-term and long-term goals. We look to kind of achieve short-term goals within about 2 weeks in rehabilitation, whereas long-term goals kind of stretch out a little bit further. So your long-term goals, they provide relevance to short-term goals. So again, it's just a look at kind of when you're designing your goals. You don't want to be too aggressive with them, because particularly in the short term, because they could be discouraging. So just some general guidelines for using goal setting. Long-term and short-term goals are interdependent. Again, as I said, long-term goals provide a sense of meaningfulness and direction for pursuing short-term goals. So again, short-term goals need to be accomplished. And I'm just using the guidelines from rehabilitation. Usually within 2 weeks, you want them to be accomplished, so they have to be attainable. And by doing that, it'll kind of give a little bit more relevance to long-term goals, and it kind of give the person a sense of achievement as they're kind of going through that process. So again, guidelines for using goal setting. We kind of talked about this a little bit already. Long-term goals, again, short-term goals are interdependent. So in other words, they have to kind of work with each other to do that. Long-term goals provide a sense of meaningfulness. Again, we stated that on the previous slide. The attainment of short-term goals provides a hierarchical sense of mastery and builds self-confidence. This is why I was saying that, again, you need to be realistic with the short-term goals. And again, sometimes you may even want to have, this isn't in your book or necessarily talked about, but sometimes it's good to have an alternate goal. Like sometimes, with short-term goals, when you're kind of setting them, you may have kind of like secondary goals that kind of help so that, if the person, kind of has kind of a range to shoot for. An athlete should define process goals to focus on elements of their performance over which they have control. So they should look more at the process goals because those are things that you have more control over as opposed to the outcome goals. And again, outcome goals aren't necessarily bad, but you have limited ability to kind of deal with them. So it's important to kind of, again, focus on the process goals. Outcome goals are good. Just again, there's limited control over what an individual can do with them.